Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Remission Possible, the podcast where we break down what it really takes to reach low disease activity and keep moving toward a healthier life. I'm Shilpa Venkatachalam, Chief Patient-Centered Research and Ethical Oversight Officer at the Global Healthy Living Foundation. Today, we're diving into something truly important for the lupus community, the 2025 American College of Rheumatology or ACR Lupus Treatment Guidelines. We'll be talking about what's new, why they matter, and how you can use them to advocate for yourself in your medical appointments. These guidelines serve as a roadmap for clinicians guiding decisions about diagnosing, treating, and monitoring lupus. But what's really powerful about this year's update is how much it reflects the patient experience. Things like communication, side effects, quality of life, and access to care. So to explore the guidelines from both the clinical and lived experience perspectives, I'm joined by three wonderful guests. Dr. Ashira Blazer is my first guest, a rheumatologist and co-director of the Lupus Center at the University of Maryland and serving on the board of directors of the Lupus Foundation of America. Dr. Blazer, a very warm welcome to you.
Hi, Shilpa. Thank you so much for having us.
Estela and Juana, sisters, fierce advocates, and co-founders of Looms for Lupus, an organization rooted in community, education, and empowering patients, especially women of color, navigating chronic disease. Very warm welcome to Estela and Juana.
Hi, Shilpa. Thank you for having us.
Thank you, Shilpa, for including not only the patients, the providers, but also the care partners' perspective.
Now, together, we're going to unpack what these guidelines mean in real life and how they can help you communicate, access care, and chart the next steps in your treatment with confidence. So without any further delay, let's get started. Dr. Blazer, let me come to you first. In simple terms, what should patients know about the new ACR Lupus guidelines, and what stands out to you as the biggest change this year?
Absolutely. So I think these guidelines are a major step forward for us in the community because, as everyone knows, lupus can be very heterogeneous. So patients may have different manifestations, and that can make it a challenge to understand exactly how to treat lupus and how to escalate therapies when necessary. These new guidelines help us understand how to treat most manifestations of lupus, when to escalate therapy, and importantly, when to taper glucocorticoids and to add advanced therapies. So what patients should understand is that if a medication isn't working, or if you're on steroids for too long, these guidelines empower your rheumatologist and you to seek more advanced therapies.
So you mentioned glucocorticoids. The guideline emphasizes lowering steroid exposure and using steroid-sparing medications earlier. Why is this shift so important for patients' long-term health? And how should patients think about this if they've been on steroids for many years?
If you look at these guidelines, one thing that's interesting is that many of the recommendations are conditional. And that is because there's an art to medicine, and because not all patients are the same, we may be able to interchange recommendations. But there are three strong recommendations in the guidelines. One is that every patient who can tolerate hydroxychloroquine should get it. Two is that we are to escalate therapies when patients are not responding to initial therapy. And the third is that we need to lower those glucocorticoids. So that is so important because over time, lupus can cause damage, but also the way that we treat lupus can cause damage to the body. So if you've ever had a cut or a burn, you know that inflammation can heal with a scar. Because lupus affects so many organ systems, when it heals, patients can have scarring and permanent damage. One of the major harbingers of that permanent damage is glucocorticoids. And in the past, many patients have been treated with glucocorticoids long-term without having it be decreased. And we know that that's a big risk factor for poorer outcomes in lupus. Now, as you said, many patients have been taking glucocorticoids for quite a while. And so it may sound alarming that now we're recommending that we taper, But one thing that I talk to my patients about is that every opportunity to lower the prednisone dose or the glucocorticoid dose is an opportunity for you to live better with lupus. So even if it is the case that you've had this for a while, you've been on glucocorticoids for a while, lowering the dose now can improve your bone health, can improve your cardiovascular outcomes, can improve your metabolic outcomes. So there's still some benefit, even if this is your case that you've been on long-term glucocorticoids.
That is very encouraging to hear. As someone who lives with rheumatoid arthritis, patients like me, we have a love-hate relationship with steroids and glucocorticoids. So it's really interesting to hear this from you. And I want to go to Juana for a minute here, because as someone who lives with lupus, Juana, when you look at these new guidelines, can you point out what feels most meaningful or validating for you personally and why?
Well, the guidelines definitely show us patients that we matter. They confirm us that there was enough research to know and understand about how the steroids were harming our bodies. And that now that the research and the findings, there's ways on how the doctor's going to be working with the patient to taper off the steroids safely with other medication. And the fact that we as patients are given a voice really matters. I believe that for us, patients is very important of having a voice, and working together with our specialist, our rheumatologist, is not only empowering us, but it's also giving us more of a voice and be more compliant with sharing the decision making, with lowering the steroids and having different therapies that are going to be helping us better in the long run, and not getting the damage that we would have with taking the steroids for a long time. As a patient who has taken steroids, I can tell you that it was very difficult, not only emotionally, physically, because that was also affecting me with my sleep. It was helping me in many ways, but it was also affecting me. So the new guidelines are very helpful for all of us lupus patients.
That is so inspiring to hear that the guidelines resonates with the patient experience, right? Along the same thread, Estela, I want to ask you, you're a caregiver to someone who lives with lupus. What is it that you find as a caregiver, from the caregiver perspective, that resonates most with you when you look at the guidelines?
As a sister of someone and someone who cares about my loved one that lives with chronic autoimmune condition like lupus, having these guidelines being updated means that someone is continuing to look into how to better take care of these patients. What really speaks to me with these new guidelines is the fact that we are focusing more on the shared decision making, which has been a big part of how Juana was able to, first get her diagnosis, is she spoke up and her provider heard her. And so I think that's one of the things that's super, super important. Another thing is that there are no two people alike with lupus, right? They're like snowflakes. So it's very important to be able to work one-on-one with a patient, listen to what the patient's concerns are, and together work on the treatment that is going to be specifically for this individual. So it's not like a one-size-fits-all. It's more like a one-on-one, which has always been something that we want to empower and encourage the patients, is to be prepared, to be able to utilize their voice and to be part of their treatment. So for me, that's one of the things that's really, really important.
So well said. And you alluded to the fact that there is no one patient who is the same as the other. And I want to come back to you, Dr. Blazer, because you have done so much work around lupus in underrepresented communities. We know now that lupus disproportionately affects Black and Brown communities. First of all, does the guideline address health equity? And can you talk a little bit about how it does so? What is one thing you wish more clinicians understood about applying guidelines in real-world setting, especially when it comes to underrepresented communities?
Yeah, and I think this is so important. And what Juana and Estela have said really resonates with me, because when you think about getting a diagnosis of lupus and getting the correct treatment for lupus, really you have to come into an encounter with a doctor, and that doctor has to listen. That doctor has to know how to connect with you and listen to what you're saying. And I think one thing that the guidelines do is it really stresses that shared decision making. And there are actually patients in the room when the guidelines were created. And I think this is a really important example of how we should listen to our patients from the forefront. So when we think about health equity, 9 out of 10 patients with lupus are women. Most of patients with lupus are women of color. And these are groups who are traditionally not listened to in the healthcare system. And we talk a lot about trust and mistrust and its role in disparities, but the other part of this is being trustworthy. And if we're honest, our discipline has not been trustworthy to these patient groups. And so I think one thing that the guidelines do very well is they allow us to understand how to escalate therapy and that we should be escalating therapy. One of the reasons why Black and Brown patients tend to have poorer outcomes is that regardless of socioeconomic status, Black and Brown patients are more likely to get chronic glucocorticoids, and they are less likely to even be told about advanced therapies, let alone be prescribed them. So these guidelines let us know how every patient with lupus should be treated. So they set a standard. And I think that's very important because no 2 lupus patients are alike. The therapy can be very, very subjective. So it's very easy to say, okay, this person came in, I put them on glucocorticoids, I put them on hydroxychloroquine, they're not feeling better. Well, maybe I would expect them to feel better in 6 months or 8 months. So I'm gonna wait and see what happens before I ever escalate therapy. Or, oh, this person came in, they're saying they have aches and pains. Is that really from lupus? Is it because they have fibromyalgia? Is it because they have a mental health problem? I'm just not going to escalate my therapy. And when you have biases around certain groups of people, you are less likely to escalate therapy under those conditions. You are more likely to explain away symptoms rather than listen to them. And so I think with the granular detail of these guidelines, it really says, if you're seeing X, you need to do Y. If you're seeing Y, you need to do Z. And I think that standardization and that especially emphasis on treat to target and disease modification will allow people to think twice before they sort of push off the symptom to the next visit and the next visit and the next visit.
That's great. So the key here is listen to the person who's speaking to you. Listen to what they're saying carefully. And thank you for all the work that you've been doing for Black and Brown communities as well. Estela and Juana, for lack of a better word, you are boots on the ground. And since you do so much community education through Looms for Lupus, if you were explaining these guidelines to a newly diagnosed patient, how would you break them down in simple real-world terms? Just give us 2 or 3 ideas of how you might do this. And I can start with Estela and move to Juana.
I think the first thing is letting them know that it is going to be about you, the patient, that things are shifting and that these new guidelines are patient-centered. And we've heard we're patient-centric this, but I think with like Dr. Ashira was saying is it's about treating the patient. It's about listening to the patient. What other symptoms are they having? Or is the treatment that's being given to them working? And I think really for me, letting them know that it is about them. The patient is going to be seen, the patient is going to be heard, and the treatments are going to be based on what the patient needs and what the provider together with the patient will come up with a good treatment for them.
Lovely. Thank you, Estela. Juana?
What I would share with the patients is that our voice matters. Our voice matters as much as the lab numbers that we get when we get our lab work. A lot of the times, as patients, we feel that we're not being heard, that we're not being believed. And what I would share and explain to the patients is that we are now being heard and that they're paying attention not only to our numbers, but they're also hearing us about how we're feeling, the pain levels. And basically, that's what I would share with them, that we have a voice and that we are being heard and that together we are going to be making decisions with our doctor, that we're partnering together, that we are not being told what to do, but we are together having a shared decision as to what we're going to be doing to better our health.
Wonderful. So, again, the key words that resonate here are shared decision, we're a team, listen, Now, Dr. Blazer, as a clinician and hearing what Juana and Estela are describing, how do you think clinicians can better translate what they're describing into real changes when you have an encounter with your patient?
Yeah, I think the first is to set expectations and to set expectations with regard to your goals as a physician, but also to listen to the patient and understand what their goals are. And I think one thing that these guidelines do is they allow us to level set. Right. And this is one thing that I like to do with my patients. When you're first coming in to see me, I say, here's how lupus can affect your body. This is the target that I'm looking for. And these are the 3 things that I'm going to assess every time you come in. Now, if you are not meeting these goals, we are going to talk about changing your therapy. If the medication we choose is not tolerable for you, we are going to be talking about changing your therapy. And I think because we have this so explicitly laid out in the guidelines, we can have that conversation up front with our patient. And I think that is really going to change, because one thing that Juana was saying is sometimes when you feel terribly and you take steroids and they help you feel better, it becomes an emotional challenge to say, now I'm going to stop taking them. And I think if you can't describe why it is that that needs to happen, it's hard to get buy-in with the patients, because they say, hey, I felt bad before. This medication is relatively inexpensive. I took it. It gets me feeling better. Or I'm afraid to come off this medication because what if this other medication that you're giving doesn't work as well? So I think that being able to say, hey, steroids are your frenemy. They will help you up front. Long term, here are the problems with them. This is how I'm going to assess you and make sure that you're doing well. So like one thing I say to my patients all the time is, if it doesn't work for you, it doesn't work. I think a lot of patients get afraid that like, oh, I'm just going to take their steroids away and I'm never going to give them back, even if they have a flare up. Or I'm going to give them this medication and it's going to make them feel sick and terrible. And I'm not going to listen if they feel bad. You just have to take the medication. That's what we decided. That's not what it is. And so I think it's important to know that there are lots of different ways we can treat. There are lots of different medications, thankfully, that we can use now. And here's where we're going with your therapy.
Wonderful. I have to say, I love the fact that you call steroids frenemy, because that's exactly what they are. So you're saying use the guidelines as a sort of a roadmap, really, to engage in conversation, shared decision making with the patient. We've talked about the patient clinician perspective in the guidelines. Estela, I want to ask you about the caregiver's role. You did talk about how they resonate with your experience, but often caregivers are left out of the conversation. So, what can we do better to bring in caregivers into these conversations as not just something that happens every now and then, but more as a norm? Can you talk a little bit to that?
That's one thing sometimes that is missed is caregivers. They are a part of the care for their loved one and their patients. And so we are often not recognized and overlooked. And I think the simple thing that can be done is just simply be included. Be included in the conversations. Ask if they also need support, because sometimes we can't pour from an empty cup. So we might need a little more information. We might need maybe support for us to be able to support our loved one. So I think asking those questions, including caregivers and care partners in the conversation, or including the caregivers and care partners in conversations is something that I think is sometimes overlooked.
Wonderful. And such a powerful way to communicate that. So thank you for that. We don't have a lot of time left, so I want to ask a few more questions and get them in there. One of the most important things that we hear from our patient community is the barriers that patients face. Now, many people with lupus face barriers, of course, that include things like cost, insurance, access, and importantly, not feeling believed. Juana, what's one thing you wish more clinicians understood about these challenges?
One thing I wish more clinicians will understand about the challenges is that living with lupus isn't just about managing lab results. It's about navigating fatigue, pain, and the invisible parts of the disease that don't always show up on test. Many of us struggle with the cost of medications, access to specialists, and sometimes not feeling believed when our symptoms are dismissed. What really helps most of us is when clinicians listen, validate our experiences, and work with us to find treatments that fit our lives as well as the numbers on our labs.
And to that point, that's such an important point, Dr. Blazer, as a clinician, how do cost, insurance, access barriers affect you as a clinician who is treating your patient?
I think a lot of it revolves around getting medications approved. Well, a few things. Getting medications approved can be a huge challenge. And so I think another good thing about the guidelines is that they allow us to have an anchoring and a source of literature to say this is necessary and here's why. The other is patients who can't access healthcare are not going to do as well. They're not going to come to appointments. They're not going to be able to take medications. And so I think the cost, the burden of disease, also disability. I think this is one thing that physicians don't understand very well, and we really should, is how often our patients experience disability and are unable to work. And then also how often getting disability benefits further prevent patients from seeking employment. I think that this is a major barrier for our patients that we don't assess often enough and don't understand. And often will say, oh, well, I prescribed this medication to a patient, or I asked them to come back to this clinical visit and they have an issue with non-adherence. And we're not asking the questions that help us understand why that person is not engaging in their care. So I think all of these things that affect the lives of the patients also affect the treatment plan. And it's something that we really need to engage with.
That's a great point. And as a result, the outcomes for the person living with the disease as well.
Yes, as a result, the outcomes will not be as optimal as we would like because of these other issues affecting their lives holistically.
So this has been a fascinating conversation. We've gathered input from all perspectives, which is so important. I want to end this conversation and hope for many more to come on a note of optimism and thinking about the future, right? So a last word from all of you. What is the main takeaway for people listening to this episode? What would you say is, from your perspective, the main takeaway from the ACR 2025 Lupus Guidelines? Let's start with Dr. Blazer.
So I would say the main takeaway is that all of our patients should have access to quality care, which means that we are escalating therapies that minimize toxicities and improve outcomes, while also lowering glucocorticoids and assessing patients more holistically. So including lifestyle modifications, including comorbidities or other medical problems that patients may face, and also damage to patients' bodies over time so that we are able to holistically care.
Fantastic. Estela, I'll go to you next.
Yes, I would say with these new guidelines, it is more about shared decision making. It is about setting achievable goals for both the patient and the provider. And, it is really, truly patient-centered. So that is the one uplifting and empowering thing about these new guidelines.
Wonderful. And Juana?
I think that the main takeaway would be that patients, we have a voice, and that together we are working with our specialist, our doctor, as a partner, and that definitely our voice is heard. And as a patient myself, I think I would be more compliant if I share the decision of taking the medication that will help me. And that's my takeaway.
Wonderful. Stronger together, healthier together. On that note, we're going to end this very interesting and fascinating conversation. Thank you so much to the three of you for joining us today and for taking the time to speak with us. Dr. Blazer, thank you very much for joining us. I know you have a very busy schedule. And Estela and Juana, likewise. It was really important to hear and to bring together the clinician perspective alongside the patient perspective and the caregiver perspective. So thank you, three of you, very, very much indeed.
Thank you so much for having us.
Thank you for having us.
Thank you, Shilpa.
So as we've seen from this conversation, the 2025 ACR Lupus Treatment Guidelines are an important tool, but like any tool, what matters most is how they're used with you, not on you. As someone living with rheumatoid arthritis myself, and as someone who has helped shape RA treatment guidelines, I want to leave you with this. You are an equal partner in your care. Your voice is not optional, it's essential. Ask the questions, speak up, make sure your treatment plan reflects what matters most to you. You deserve nothing less. Thank you for listening. If you like what you've heard, be sure to rate our podcast. write a positive review, and spread the word by sharing with your family and friends. It will help more people like you find us. This episode was made possible with support from AstraZeneca. And before you go, take a moment to explore the other great podcasts on the GHLF Podcast Network. You can find them all at ghlf.org/listen.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.